Kidney transplants rose year over year in the Southeast, which means the need is ever increasing. Joining us is Dr. Tracey Rice, transplant surgeon and surgical director of the Living Donor Kidney Transplant Program at MUSC. And you perform some incredible, very important work here in South Carolina, but as we hear in the Southeast. So what exactly is the need right now for kidneys?
Yeah, so the need for kidney transplant is pretty tremendous. So on the national waiting list, there are over 130,000 people in the United States who are waiting for a kidney transplant.
Wow.
Unfortunately, though, that doesn't even capture the entire volume of patients with end-stage kidney disease who need to even get on that list. That volume is probably about 10 times, so maybe 1.3 million people who are waiting to get on the list.
And then when we're talking about people who need versus people who want to give, what are those numbers?
Yeah, so when we talk about people who are able to get a kidney transplant, there's generally two types of donors. A deceased donor, who's somebody who's passed away and fortunately is kind enough to donate their organs after death. But then largely living donors is also an option. So here in the United States, we perform about 5,000 to 6,000 kidney transplants via a living donor. And from a deceased donor, generally about 19,000. So overall, we're hitting about 25,000 people who are receiving a kidney transplant, where again, our need is over 130,000 people in the United States.
That's incredible. What's the main cause of renal failure, of kidney disease?
So particularly here in the Southeast, hypertension and diabetes are the two biggest causes for kidney disease. Very difficult problems to manage. We certainly rely on a lot of care from our nephrologists and primary care providers to help treat our patients. But ultimately, when our kidneys fail and patients end up on dialysis, then dialysis takes quite a tax on the body and need to ultimately receive a kidney transplant.
We've had patients sitting in your chair who've said that they've been on dialysis for years, that they are in end stage or very close there too. And it must be excruciating to have to go through that. Now, let me also ask you, are there reasons for the renal failure, kidney disease, and so forth that would prevent someone or put them lower on the list for a kidney transplant, such as someone who's in the need of another major organ that, if it happened because of drinking or smoking or some of these other reasons that they...
Yeah, when people get put on the list, we don't really look at the cause of their kidney failure for why they need a kidney, other than for making sure that we're managing it appropriately. But that doesn't necessarily change where they get put on the national list. So dialysis time certainly plays a role. Our average waiting time for a kidney in the South Carolina is 5 years, unfortunately.
Oh, I see. That's a long time. That's a very long time. But you've made incredible advancements technologically speaking.
Correct.
And so you're the first hospital, MUSC is, to perform these transplants via robot. Tell us more about this program.
Yeah, so I lead our Living Donor Robotics program here at MUSC. We were the first center in the Southeast to perform a robotic living donor. And so when a living donor comes in to do their surgery, our priority is always to maintain safety for the donor.
Sure.
And one of the advancements that we've made is to do this robotically. So we make very small incisions and use the robot to assist us in terms of removing the kidney that then one of my partners will go in and simultaneously perform the recipient operation. To minimize complications, and again, overall safety is always our priority for the donor.
It sounds like it streamlines the process.
It does.
Does it make healing faster? Does it make the transplant itself faster?
Yeah, so in terms of a living donor, we always, again, safety is our number one priority. 90% of our patients are going home the very next day after surgery. In terms of pain from the operation itself, using the robot, we've been able to cut pain requirements in half. Typical recovery, most people are pretty much back to normal activity and going back to work within 2 weeks after surgery.
Within 2 weeks. It seems like such a major surgery to be able to get back to normal so quick. And for people who are watching that are on the fence about wanting to donate a kidney, what would you say to alleviate their fears, to allay their concerns?
Yeah, it's a very safe procedure with minimal risk, with a quick recovery, and our priority, again, is always the safety of the patient. So we're always going to put that first in terms of donation. If for whatever reason you feel like you want to back out or take a pause. We're never going to force you to proceed with the remainder of the steps.
Yeah.
And again, we want to make sure that we're prioritizing the safety of the donor. But really, it's quite a remarkable gift because you truly are saving somebody else's life when you go to donate a kidney.
It is the gift of life, as they say. Dr. Rice, I want to thank you so much for joining us.
Yeah,
Appreciate
absolutely.
it.
Thank you.
We're back in 2 minutes.